whatever the worms give me, I grow. Wow. The worms just grow things for me, and I so okay, I'll try it. Everything myself, I'm not going to.
What do you mean question?
Yeah, so my little
Cherry
Romans, little baby Romans. So
Yeah, this is sweet. How
Really?
tasty they are.
yeah, they are. They're good.
Almost been all right until now.
The text being no. Use it.
Yeah.
It's just me navigating. That's the problem.
And everyone can hear online.
Can everybody hear online?
Yes, darling, good to hear you.
Beautiful. Thank you, CJ.
We'll crack into it
You're
because
welcome.
this is technically an hour long presentation and you can keep talking. So, and there's some pretty, there's a lot of content here to get through as well. So there'll be a few things that I'll sort of skip through a bit quickly, but just want to introduce myself. My name's Kiralee Stevens. I'm one of the senior risk BDMs here in Melbourne. I'm like Ray. I've been at Zurich a very long time. So this is my 22nd year at Zurich. Pretty passionate about what I do. Really see the importance around insurance and how you can support and help your clients. I'm not sure whether anyone in the room writes much insurance or is aware of our cost of care white paper. We brought out the original cost of care white paper back in 2018. For anyone that may remember that.
Yeah, I've
Good.
saw. I think maybe the iteration to it. For instance, PD Day.
Oh, did you? Okay, well, I'm not going to do that. That would have been Adam Crabb.
Yeah.
Let's just say that he's the guru. I'm probably not going to come anywhere near.
No.
So that's good. So apologies if you get a bit of repeated info, but Adam Crabb's our risk strategy specialist guru, and he put together the 2018 version of cost of care, and then we've also obviously taken a bit of time to update it, but it was very much in demand. So, and pretty much everyone in market uses this, competitors. It's just a wealth of information that we've put together to help support your discussions around the need for insurance as well. So really today, just going to go through and, show you this revisited piece of work that we've, it was launched back in October last year. And doing the circuits pretty heavily at the moment. And there's a lot of different, conversations you can have with your clients around a lot of this info. What I'm going to do is just share some insights of our new research, and then also discuss some of the tools that we've got to help you with your client conversations. As I said, looking at the purpose and the value of this research piece and the reasons why there's so much demand to update it. We're going to have a look at some of the community expectations around, just what people in society actually think about, who pays for what, where are the out-of-pocket expenses and so forth, and some of the, situations that we're all no doubt aware of that happen out in, with your customers, where there can be financial impacts, and this sort of helps to demonstrate, well, geez, we should be having the insurance conversation. We should be looking at our trauma cover and our amounts, etc. So we'll have a bit of a look at the costs and the experience, and also how unemployment consequences actually affect being able to fund situations as well, which is really important. And then just going to talk about some experiences and some consumer awareness as well. So I guess if we go back to, the original cost of care, we brought that out in 2018 and why we did that. I guess we were getting many questions from advisors about, advice, how can we build on recommendations? How can we look at some insureds? How can we kind of, look at our insurance philosophy better in terms of, we know that I guess, death and income protection, etc. You're looking at eliminating debt. How do we better look at trauma needs and the costs around that? It is a little bit harder in terms of, what are the, best ways to go about looking at trauma cover and the situations that do occur for your clients. So the research was really to try and help you understand and probably, I guess, supply more clarity in terms of, how we actually look at things. and some insights. As I said, you know, some people think that the government or someone's going to pay for everything, when in fact, I'm sure most of us know that that's not the case, and there is sort of direct and indirect costs, so to speak. And you know, there's some gaps too, obviously, with you know, private health cover.
Yeah, sorry if I could make a comment on that. That's the sort of feedback we get.
Yeah,
Not that we write insurance all the time, but oh no, I'm covered kind of thing. So then on that, do you actually have any statistics or charts or like tables to say, hey, look, if you have XYZ type illness,
yeah, totally.
well, you know what? You might be covered, but if you actually see that person that you want to see,
Yeah.
or I don't know, like this is what hoping you can help
Yeah,
us out on.
Jeff, when we get further into it, we've
Yeah,
got
sorry.
it's a good question, but we've got the research is showing, and I'll show examples where what is the average cost of, say, breast cancer,
Yeah,
you know, in a lifetime, the stats around this. And when we get to the end, there's heaps of tools. You can reach out to me directly, or I can even just send the info through as a follow-up to Caroline if you like. Because the other thing too is this white paper initially, for those that may have seen the first version, doesn't sound like heaps have, but it was like 108-page document, right? So paper. Now, hopefully we can update this a bit more frequently than that big gap. It's all electronic. And I'm not sure whether we'll get time today, but you can show this information interactively to your clients. And you can plug in as well, you're 47, these are the chances of X, Y, Z. So when you see us go through this a bit further, you'll see the different conversations you can have with clients with this research piece. It can be for new business. It can be for retention. I could talk about this all day.
yeah.
So just in light of just the stats and that, I'll go through some of it quite quickly, but I'm more than happy to have one-on-one appointments with anyone if you want to talk further about it. And I would suggest that if you are looking to write more insurance, or you do write insurance, these tools are phenomenal. So we've won awards for this. We've, you know, we're really quite proud of this piece of information that we've put together. And yes, the Regs Commission have done it all, but you know, this is to just help get the conversation out more as well, which is what we want. We want more Australians covered for insurance. So yeah, you'll see that as we go on. But yeah, feel free to ask me any questions. I'll do my best to answer them. So in terms of, the, you know, I guess why we looked at it initially, I guess consumers are unsure, to be honest, of the financial impacts of certain events. So, you know, i.e., you know, what's the likelihood of being diagnosed with a brain cancer, reoccurrences, the costs that are actually associated with these things as well. And I guess that the third factor was really to give, you know, financial planners and people working in the industry heightened awareness around the actual value of advice and the importance of wealth protection. You know, there's such a great opportunity to make sure your clients are protected with their insurance needs. There's obviously a, you know, obligation as well as a financial planner to make sure that you're having those conversations as well. So we want to provide some more awareness around that and obviously demonstrate the costs associated. So this is that's what the original book looked like. I don't think we've even got that anywhere now, but that was quite a lengthy book where you go through the different sections and look at your cancer, look at your mental health, all the different sort of areas of health and the costs. Luckily now it's all interactive and it's super cool. So I'll show you that as well. But yeah, we basically had a lot of good, I guess, publicity and good conversations around the first one. So we released the second version in October 2024, which was last year. As I said, we've won multiple awards and it's really been a great piece of work in the industry and for us in particular. So if we look at where we've come to from, I guess, our first version back in 2018, I guess, lots of requests from market for us to update this, from dealer groups, from advisors. So it's been really a good opportunity for us to, I guess, use our strength and put this piece of work out, but also to create better awareness and continue to support advisors in the market as well. So I guess, you know, we had really big demand from, I guess, industry advisors and licensees to rework this. And I guess, have we seen, how do we enhance this? I guess it's really just looking again at community and client awareness and, what are the serious health events out there as well. So there's been some new additions that have been added into this next lot of research, which we were asked for as well. Some of that's quite confronting when we get to it as well, in terms of what those things are. So I guess if we look at the, the perception, out there, as we know, some people think that, everything's going to be paid for. Some people think that private health cover is going to cover everything. That's not always the case in terms of how that works. And I guess, there's public hospitals that may charge you for certain services. You might need to, go through somewhere else through a particular hospital where there is also there may be indirect costs as well. So there's a mixed bag of things that can happen there. And I guess really the Australian health system, if you like, it's really what we call a mixed healthcare system. And I'll explain that a little bit further as we go on as well. But, there's certain things that just aren't covered. You look at things like, I don't know, maybe some cancers where, does the client need to get a wig or a scarf or, things like that. There's all these little incidental things that sometimes aren't really considered in the overall costs as well. As we know too, with trauma insurance, again, we're not getting into our philosophy or anything in the session, but, it's looking at your philosophy. Is it to cover debt? Is it to provide choices for the client if something, is to happen where they need to have alternative treatment, or they might need to go to Mexico, or, so they're the type of things that we're sort of referring to there. And it is really likely that there is going to be out-of-pocket costs, as I said, indirect or direct. And, we got lots of feedback through research and different bodies, whether it's, the Cancer Council or, and again, I can't read the footnotes from up here, but we have got it all footnoted through where all the stats and so forth have sort of come through. But, there's feedback on advisors wanting to understand and look at that more so that they can have conversations with their recommendations with their clients as well. So I think this slide here, some of you may or may not be surprised with this, when we're looking at, I'll just bring the other piece up as well, but when we're looking at, I guess, how are people / consumers currently going in the market at the moment in terms of, being able to survive without an income, if you like. I guess if we look here, it's pretty compelling here that most can only survive literally up to a month with no income. And you can see some of the percentages are actually, greater than others there as well. And this research has been done through NMG data, and it's based on clients' ages 25 to 50. So, I mean, that's a pretty big sample size. Cost of living, bills, etc. They actually don't stop when someone's sick or ill. So again, that's pretty telling order for in terms of some of that information. And the other thing is too, almost half of consumers have 5,000 or less in savings that are accessible for illness or injury as well. And again, we don't understand at the time, some of the costs of things as well. Now, I've had a personal situation. I'm not going to, dwell on it today, but where I've had to go get tests done, and it's not until you're in that moment where you're like, geez, I didn't realise that was the cost. And yeah, you're going to get something back, but then there's only a certain percentage. Yeah, and those tests that I went through in a short space of time, if you don't have money accessible, I remember saying to someone at the time, geez, if you don't have X amount of funds that you've got access to, how does someone actually go through that process? So there's situations where, there's probably people in a bad way if they actually can't afford to even get the tests done as well. So this is quite confronting. And 3 out of 4 admit that they would regret the decision not having the right insurance protection in place if they lost the ability to earn income due to illness or injury. So we're talking about the importance around having your insurances so that you can pay your bills, pay for health and sickness as well, and events that occur as well. And then, as I said, there is significant gaps in, certain coverage and benefits as well. So I mean, that's probably not surprising to anyone. Wouldn't have thought. I mean, you're probably reading about some of how long can someone go, and you know, you've got your financial planners on, not so you probably see and feel that with a lot of people you're dealing with anyway. So just quickly, you know, looking at, I guess, the you know, the experience and the contributors to the healthcare system and the costs effectively. I guess, you know, there's sort of 5 buckets, if you like, in terms of how we fund events. Now, I'm not going to go through all those stats and numbers. You can sort of have a look at them yourself. But really, I guess, you know, we say, well, where are the funds coming from the government to fund a lot of this? Well, the answer is funds coming from us, the taxpayers. And yes, private health, you know, care and insurance is important. But, you know, you can see through a lot of this information the relevance and the need for personal insurances as well.
So that's saying that they've been paid out, or a combination of both, where
Yeah.
they did have insurance and they paid, and they didn't have insurance and they still paid.
Well, a combination, but I guess it's about choice and it's about the unknown and about this significance. And as we get in, seeing how much some of these events actually cost. As well, that, you know, you've got the insurance, and there's a few sort of case studies and examples that we'll go through. Not only does this affect the client, if there's a family involved and someone else has got, I mean, the implications are huge. There's a whole section we added to this, which is the very confronting part, especially if you've got kids, where, you know, the impacts and the stats around child traumas are significant. Now, if that happens, the adult's got to be out of, you know, work. Now, I've got 4 children, so, and like most people, their kids are everything. So when you see some of these stats come up, you go, oh, and again, that's another reminder. Are you talking to your clients about the need for child trauma cover? It's cheap as chips. So, you know, as I said, we can go on, I can talk about all this stuff very passionately, but you know, looking at some examples as well, and I'll sort of go through this as quick as I can as well, just in essence of time. But you know, you've got situations. I mean, this is you know, some research and information we got from a client that had a brain cancer, and you know, his work was helpful for several months. And you know, he ended up in a bad position where he actually had to rely on getting food and so forth from a charity, and then ended up having to sell his car, you know, borrow off family to make ends meet. This is all while going through radiation treatment as well. So, I mean, that's the last thing you want the client to be going through, you know, and again, the insurance is there for the financial support to help with the emotional side, as you know, as well. So it's just trying to demonstrate that, you know, someone's going through a tough time, they don't have the nightmare of trying to organise their finances as well. Hence, that's where you come in with the insurance and making sure they're protected as well. I guess, you know, when we looked at the overall experience and what consumers actually tell us as well, costs can be quite high for clients with certain medical events, and they can be high for those around them as well. So, you know, it's, you know, a lot of cancer patients tell us about the out-of-pocket expenses, you know, some of the care options that they've got. You know, you might have someone that actually needs to pay for some sort of expensive drug that's, you know, got an out-of-pocket cost, etc. as well. And I guess too, just the financial stress as well of someone going through having an impact around a health event as well. And then it's loss of household income as well. So, you know, as I said, someone's got to be off work. You know, is it 2 people? You know, you don't know what the household situation is. Yeah. So if we just look at some insights, and again, this is all updated from the first lot where, you know, we're basically looking at the stats, the average diagnosis, the age, etc. You know, most of us know and are aware of a lot of this stuff. So, you know, like there's 56 new cases each day of breast cancer. There's a 5-year survival period. The likelihood of someone getting it in their lifetimes, you know, 1 out of 7. And then the average lifetime cost can be up to 41,000. And, you know, when the research, we look at various different things. I won't go through the breakdown, and our research, basically you can see all these from an age perspective, etc. as well.
Can you see it from like with averages, as you know, large lumps at either end can skew the actual average, median versus whatever the other one was. So can you see like most cases might be 5 or 10,000? In the rare case, it might be 200,000.
Yeah, I think we've just got an average in terms of average costs. So when we look at the data, everything's pulled together and looked at an average as well. So in terms of the research, in terms of where we've got all that from, we have considered patients with private health insurance as well from 2021 to 2022. And then a lot of the data is also on certain things. This is from the Breast Cancer Research Australia as well. So, all our information has been seeked from the relevant bodies as well, and stats, etc. as well, where we've, pulled it together. But it is based on averages as well. So when you're looking at your recommendation, you're going to be looking at several things. This is just giving you a guide, I guess.
Yes.
And
Just out of curiosity more than anything.
Yeah. So yeah, just looking at some stats around that. So
Yeah, I think that is the other tool that you've got, what is it, the Someone Like You
Yes.
tool, which is where you go, oh, I'm a 34-year-old male and whatever it is. And then it says, okay, well, because of you, this is the likelihood of these different health issues. And then you go, okay, well, I'm going to look at what it's going to cost.
yes.
Yeah, I'm probably stealing your thunder there.
No. That's a tool that's available to you for you guys to use. And so you can use that. That's what I'm saying. That's a brilliant tool that you can use with multiple different conversations. I've got advisors that are using that. Obviously, affordability with anything's huge at the moment. So, you get a client that's had their renewal notice, and obviously we're seeing premiums move around, claims are increasing, etc. So they might be calling and say, hey, I'm not sure about this insurance, it's gone up by 20% or what have you. You might be saying, well, hey, and it can be confronting, right? Oh, you're 56. Just wouldn't mind showing you that this is some of the things that can occur, and these are some of the costs associated. Now, I don't know whether you do it as in there's various ways you can do that, but there is advisors that do that. There's advisors too that actually say, you can obviously have lots of conversations before they go to the path of I'm going to cancel. But at that last point, do you think you should go get a health check?
Last practice, we were paid for client medicals.
Yeah.
It was literally, you're not touching your coverage until you go get a panel of bloods, ECG, tick it off.
Yeah. No, it's true. I read something on
The amount of people that ended up claiming as a result, we're like, hey, you found something really absurd
Correct.
that I wouldn't have found anyway.
Yeah, that's right. I only read something on LinkedIn last night from an advisor that I know that wrote something about, I can't remember the age of the client. The client was hell-bent on trying to cancel cover or saying that it's this and it's that, and he instructed him to go get blood tests, and the blood test brought up something, and then he was paid out 120 grand with his premium, which then in turn helped his family with XYZ. I mean, they're the situations that we're talking about. And we're talking about the absolute unknown as well. So, and the stats and the things that, you think are not going to happen to you. Like this situation here, I was diagnosed 4 years ago. And I don't tell anyone that for anyone to have pity on me or anything like that. But, I was one of them people that you're going along and you think everything's great and it's like nothing's going to happen to me. I'm fit and healthy. I thought I was the fittest I'd ever been. I turned 40 and I was diagnosed, 3 months later, and I've been through a lot and it's ongoing, but it's just the reality that, I had insurance in place. I'm passionate about that. I know, and I've got a family and I'm in the system though, right? I get all that. You're talking to clients who've got no idea about any of this or how it works or what the impacts are. And that's why I say you all know someone that's had a scenario happen to them. You're in a very good position to be able to talk to them about how this all works and what the impacts are. Do people like paying for things? Sometimes that can be hard, but we're talking about the value as well and what that can, help someone with. So moving on. Again, you can, I'll sort of go through this a bit quicker, just in a lot of time because we could be here all day. And it's already, this is really an hour 10 sort of presentation. So you can see some of the costs that are associated here. As I said, they are average costs, etc. as well. And when you're in the white paper online itself, as I said, you can have a look at where it's all footnoted, etc. as well. But all of this very common and very common conditions as well. So like leukemia is another one. These stats are based on a survey done with, nearly 5,000 leukemia patients. This is from the Leukemia Foundation and the Blood Cancers Australia report from 2023. So you can just see, some of the out-of-pocket expenses and the costs there as well. So like 46% had out-of-pocket treatment costs. Now they could look like a range of different things as well. But we've got people that are, need to take off time off work, and then they end up relying on support from different institutions as well. A few examples and things that we've sort of, as I said, we've sort of, spoken to and got some, I guess, that these ones are actually from GoFundMe type scenarios that have been looked at as well, which we're no doubt aware of how all that works, where people are reaching out to help with their situation. Now, I'm sure people have got mixed thoughts on that. It's great for people to get help, but you've got people that are in really bad situations that are basically out there crowdfunding for help around their situation. Now, again, insurance, would cover off the help for a number of these things as well. Now, I'm not going to read through the examples there, but I'm sure everyone's aware of what I'm about there. Melanoma is another, melanoma is diagnosed more than prostate cancer, breast cancer, like it's, I guess, something that we're hearing a lot more about. And I guess one to be aware of when you're looking at your definitions in your trauma contracts as well. So I'm not going to talk about product, but that's one that I'd be making sure that you're across. I guess there can be a lot of, 2 in 3 people have said that they've got out-of-pocket costs, and that's during the active treatment as well. And I guess a lot of the feedback from these consumers too, or customers, said that they would like to have better access to treatment options and care to reduce their out-of-pocket costs. So, that's when we are talking about, you've got this cover in place because you might need to have X, Y, Z, or you might need to go to have some special treatment. And if you've got the money and the options around that, yeah, correct. Opposed to someone that can't afford certain treatments, etc. as well. So, so this is where we get into, as I said, with our, and that's a little bit hard to see, but this is really cool when you look at it in your system, on our portal under the Zone Education, which I'm sure most of you are probably aware, that's our online learning platform. Ray and his team have investment stuff on there. We have insurance stuff on there. It's super handy for you to upskill and look at, but this is all interactive on there. So with the health conditions that we look at, we are basically looking at sort of the 11 different health systems. Now, it's a bit hard to read from there, but you can see it all in the different colours. You got cancer, you got respiratory, etc., injuries, etc. Now, one of the new ones that we added in, which was asked for, and we were really pushed to put this in, was a piece around infants and children. And let me tell you, this is very confronting. I know that Adam has presented this to a lot of different dealer groups, and people have kind of gone, wow, that's, that's a lot. But it's important that we sort of continue to put all this information out as well. So I guess these stats here, and again, this is confronting. I'm not going to read any of it out, but you can have a bit of a look at that for yourself. But it's just pointing out the infant and child injuries and illness that we see on an average week across Australia, and some of the things that we see. Now, you're aware of the Royal Children's Hospital and, all the great work they do, etc. And yeah, there's the sad thing is that the average age of children, I guess, is quite young as well, where things can actually happen. So, you know, as I said, 14 new cancer diagnoses of children under age 15. You know, we've got a range of different things, burns and so forth. So lots of hospitalisation each week, etc. If I go to the next. And then you look at the average month as well. This talks about lives lost as well. So, you know, lots of, you know, terrible things happening in that space. And I guess, you know, you can see the age as well. So, you know, average age is 4 to, you know, to 5 for some of these things as well. Most insurance providers that you would be using would have child trauma cover on their contracts. Works a little bit different with some of them, but, you know, majority actually start child trauma cover at age 2. So, you know, important to sort of understand how that works. It is cheap as chips in terms of what most of the contracts cover. There is, I think, a few providers that actually even provide X amount for free. Don't quote me on that, but I think there's a couple that do X amount for free. So worth being aware of that, and particularly with, you know, when you see all these stats that are out as well. You know, and you can see even like, you know, the out-of-pocket costs as well for a child. Now that's, you know, we're talking meals, we're talking about being in hospital, we're talking about maybe a parent needs to not be working, etc. So there's a lot that you can take away from that. And, you know, not even thinking about, you know, the stress as well that the family's potentially going through as well.
And Zurich is 2 in the age 2.
2, yeah.
Is that the lowest in all insurers?
I'm pretty confident they're all 2. I'm 95% sure majority of the insurers will be 2. The other thing is that most, and, you know, I'll show you a few things from a Zurich and OnePath perspective, because we've got child trauma on both OnePath and Zurich cover. They work slightly different. I'm not going to go through that today, but for example, most of your child trauma policies in market actually have the ability to convert over to an adult trauma policy.
Yeah.
So when you're looking at your clientele and intergen advice, it's a great way to keep clients going through, but also they don't go through underwriting. So all you're typically telling us when they're age 18 is if they're a smoker or not. And then we convert it over to an adult's policy.
Yeah, spoken before that.
Well,
Why not?
Vaping.
Yeah.
Why not earlier though? Like, why? There's just such a, like, 2 is.
I'd have to ask our product
Yeah.
people around that. I mean, there's not a lot of stats, even though that data is really strong. In market, the insurers don't have a hell of a lot of data on.
Actuarial would be very difficult to price.
Yeah.
So again, why I'm asking is it's the question from some clients that I've brought it up, and it's only been a couple.
Yeah.
And some of them are friends, so they could probably freely ask a query if like that as well. That they've had to wait until their child is 2.
Yeah.
And they say, well, why are we waiting to see if anything arises
Yeah.
until they're 2?
Yeah.
Like,
Yeah, I don't know.
they're like being smarter. Like, they're sort
My
of.
kids are older now, they're 17 and like 15, but
Yeah.
I tried to do it when they were really little as well.
Mhm.
And it was age 2. And
Yeah,
it was
yeah.
as well. And,
Yeah.
and what I was told was because of certain events,
Before then. Yeah.
if there's like, you know, heart issues or
Yeah.
all those sorts of things seem to arise.
Yeah, I think that would be right in terms of, you know, if something's going to happen between then. I mean, we underwrite the kids, right? So if there's something wrong medically or anything with that, and when I say underwrite, we're not, you know, doing what we do with an adult, but, you know, the parents still got to fill out and tell us if there's any health issues. And I've seen where there's been cases where we haven't covered a child, and that could be because of a particular health issue or whatever they've got. When we're underwriting on the child, I'm pretty sure there's about 9 to 10 sort of questions that get answered. And that's changed over time. Years ago, when we first had child trauma cover, we didn't underwrite the child. It was like you've got X amount of kids, and if one claims, it's off the policy and you get X amount. We had a lot of feedback from advisors, which really made sense. We underwrite all cover up front. So why are we doing that with a kid? And generally, the family and, you know, the advisor, you want to have the underwriting up front to make sure that, that you're gonna get a claim paid. So that changed very quickly, and it changed too that you can underwrite X amount of kids. So for example, you've got, X amount of kids, you can do them for a certain amount of cover or the same. Now, I think we've got the highest coverage in market where you can cover up to 500,000. And then there's certain things covered off. But yeah, it's really something to be aware of.
You wouldn't know half the time until they're a certain age whether they've got anything wrong with them or.
No, that's right.
And that's probably the same. Yeah,
So I
so
agree. It's the question. They're not, again, as I said, like that person's a friend and they're sort of asking, not in a smart ass way, but it's like, oh, well, why is it 1 or why is it 10 then? As well, like
Oh, from an age
from
perspective.
an age perspective.
Yeah, I mean, that you could say that on the
Yeah.
conversion age as well, because like One Path and Zurich, where they convert to an adult's policy, they're different ages as well. So I mean, as I said, the products are going to work differently. I mean, you've got an insurer that is willing to offer X amount for free as well. How come that, again, it's with your product design, it's actuaries, it's claims. We don't have those stats that are really compelling. We don't have as an industry heaps of stats around child trauma cover. It's relatively still new and unknown.
Very popular first came out.
No.
Like my policy is a conversion that my parents had when I was an old AMP one from back in the day, effectively.
Yeah, wow.
When they're looking at underwriting the children, do they consider family history the way that they do with adults?
Yeah, that was the other question I was gonna have.
They do.
So family history comes in generally all underwriting. In terms of, I mean, we can pre-assess for that as well. It's like history of cancer and so forth as well. And
Yeah.
relevant to the age of the client as well.
I
Okay.
was going to say typically
Yeah.
as well, like if you've got the child trauma policy, it's attached to the trauma policy of the parents. So you've already given
Yes.
all of your family history of what you
Yeah.
are. So
You
like,
can't have it on
it's-
its own.
Yeah.
Yeah.
So it's not a step.
No, it's not a
So that's why
standard.
it's cheap as chips is because
It's linked
It's
together. The
linked
risk
to the-
is together. Yeah, but I mean, have a look at it. I mean, if you've got a policy now and you need to add, your kid on or whatever, you do an alteration. He covers with us. You do an alteration quote and add it on. Sorry, going off.
Don't get right finished early, so there has been a time I've asked like.
Okay, yeah,
Yeah.
there's quite a bit more to get through, so.
That's okay.
But yeah, I mean, this is,
Shirley's got a session as well.
Yeah, I understand it for it.
yeah, this is all quite interesting, but, I mean, this is another, again, sort of you read through that. And again, we're aware of these situations and you no doubt read and hear about these situations as well. But, that's a childhood brain cancer and just a scenario and in terms of how that works in the public health system as well. Some of what the individual had to go through as well. So again, stressful situations where you want to make sure it's looked after the best way possible. So you can see, 1 out of 6 cancers are brain cancers for children as well. This is just having a quick look and again, try not to, we don't really add much product element in because again, we're not here to flog the product. It's really just pointing out a couple of features, but on the One Path side of things, on our child trauma cover and child cover, there's actually an accommodation benefit. So again, when you're looking at your providers in market, they've all got something different, but there's this accommodation benefit where we can reimburse up to $500 per day. So that's quite, good. It's quite good too for regional clients. So like if you've got someone in the country that actually does need to travel down to the Royal Children's Hospital, these type of things are good to be, aware of. And of course, it's difficult to have a conversation like this around with your clients, but again, they're probably going to be grateful for the conversation because this is reality. Like, we're not hiding anything here. And then on the blue side, which is Zurich, so we've also got a carers benefit as well. So, so for a child cover benefit of 200 or more, there's a monthly carers benefit that could get paid out to the policy owner.
Is that an additional benefit or
Built in.
it's just built? It's built in. Yeah, that's part of it.
Make that IP on top.
no, this feature is built into the child trauma cover.
Child. Yeah, sorry, that's it.
Yes, it's like a replacement.
Yeah.
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 You've got to be off work for your kid.
Yeah.
Yeah.
So yeah, so that's what's important. So with the child trauma cover in market, there's different features like this on the different providers worth being across in terms of how they work. But yeah, you can see the, you know, with the stats we brought up the importance. Obviously too, you're dealing with someone with a family. There's multiple, you know, ways you can talk to them about the need for it. And as I said, intergen advice as well. You know, your client's not going to be your client forever. How do you keep the next generation coming through? It's quite a good strategy that we see people sort of go with.
So even with that one, I think I just noticed there was like, as an example, I could be the policy holder, but if my partner had to stop work
Yes,
to care, they can still
Correct.
5,000. That's pretty good.
correct.
You don't even need the,
You don't, yeah, you might forget to be honest.
No, you wouldn't typically get, I don't know, would you get it twice, like
2 kids in a different feature again.
potentially, but yeah, again, that's another conversation.
Yeah.
You're not going to double this.
I am lucky.
This other piece, is quite interesting as well. And, you know, if you're working in the investment space or retiree space, again, this is, I don't know, I sort of thought initially, is this surprising or not? But then you go, oh, no, it kind of makes a bit of sense, really, in terms of what you see and knowing, you know, friends or family out there in terms of why they don't retire or what actually happens. But 60% of people retire due to reasons other than reaching retirement. So, you know, is that from sickness or injury? Is it, you know, they're retrenched or, you know, disabled? You know, they've had to retire because they've had to care for someone. Yes, there's some quite compelling stats around that where people are actually not retiring as planned. Big majority of that is obviously based on sickness or injury. So, you know, their plans are out the window, so to speak. And I guess the average, you know, age is 55 where people are stopping work for the right reasons. What's this one? This one's looking at early retirement and a prostate cancer situation. So looking at, you know, the impact, and again, this is a good one, you know, just to workshop through as well in terms of the needs for insurance cover as well. I mean, how much lost income the client has based on stopping work so early, but then what about his financial, you know, the costs with his treatment or his medical situation. There's indirect and direct costs, you know, and then there's also the lifestyle adjustments to worry about as well. And I guess, yeah, we've talked about, so, you know, again, looking at your, you know, insurance coverage, looking at the particular claims out there as well. Everyone's probably no doubt aware that TPD is under a lot of pressure in market, and that's based on the increasing claims, big claims, lots of claims, and I guess TPD is really in the same sort of pool really at the moment that income protection was in. Frustrates me a little bit because, well, yeah, I mean, it's assessed the same, so it would have been great if we changed it all at the same time, but we don't do that. So yeah, I mean, you'll see we brought out a new option on our TPD last year. You've seen rates change, etc. around TPD, so it's important to sort of understand this piece about working as well, and about some of the impacts as well.
So that 19%, sorry, is that overall holistically?
Yeah, in terms
And
like
then 50, or is that, sorry, just Zurich, and then
in
56%?
terms of the stats, in terms of they're our OnePath and Zurich stats between 2021 and 2022. I think the first numbers
56, just trying to follow.
OnePath is the first number of
OnePath
Zurich.
first, so it's
Oh, okay, and then 56%, OnePath and Zurich percent
Yeah.
increase in retail pay between 21 and 22.
Yeah.
It's massive.
and that would have grown since.
Oh, is that because maybe there was none in 2020?
Oh, this is just a sample size that
Yeah.
we've run from that period of time. But you look at any stats from any insurer, TBD claims are through the roof.
Sorry, that was not being smart. We'll say 2020, there was not many claims generally.
I'd have to go back and look at the overall.
I think that was between 21 and 22.
Yeah, no, that's what I'm saying, like 56%. Oh, sorry.
Because your 19's one of the insurers.
Yeah, that's the other.
This is the other insurer.
It's a bit,
It's not like,
No, on the bottom right, it says, there's an asterisk, number 1 next to 56 at the top.
yeah, so that's one part.
And then it says one path and Zurich
So
percent
The
increase.
increase of.
I can double check that.
yeah,
So that's their increase between.
21 and 22.
Yeah.
Does that make sense?
Yeah.
Respectively, not.
Yeah.
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 An increase in 21 and 56% in 22. Is that what you
Yeah.
So the reality is they're growing and they're big claims. And I talk to advisors all the time that, it's not the advisor's fault and it's not the clients literally had a lotto win, so to speak, and they made that work because of how the definitions have worked and how the product's been quite generous, which is why you're seeing, mental health makes up a third of TPD claims.
So how much of it was?
Huge. How do you actually change that with the design of the product? It's not any like that. The products are very, in Australia, insurance products are very generous, very, very generous. And that's why we saw income protection, come into trouble as well. With TPD, Zurich's been the first company we brought out a TPD care option. Again, I'm not going to talk about that in a lot of time. Happy to meet with anyone about that, but that's to try and combat the issues that we're facing. It's a different optional product. It's cheaper. There's a few things that go with it, but really we want to get in front of legislation. The issue with income protection is it got that bad that then legislation had to get in. We're trying not to let that happen from a TPD perspective in market. And you would have seen with different insurance companies, in-force books have had, 20, 30% pricing increases. That will probably still continue until we get a new product or something in market that can work better around this. It's quite challenging.
The issue is going to be that if you want to keep your old policy, they're going to keep jacking it up though, aren't they?
Potentially, yes.
So if you've got the loose terms, then they're going to force you one way or the other
Yeah.
to either change.
Yeah. But if anyone does want to catch up and have a chat about the new TPD care option, because there's reasons that you look at that, affordability, claims stats, there's different advisors have got mixed thoughts on TPD, and some say I've never had any claims, it's too hard to claim, or that went on for years. And then there's others that go, geez, my client just got paid out $3 million, they probably shouldn't have. So yeah, we can talk about that separately.
And then on that, from the earlier stats, similarly on the TPD stuff as well, what's the most common? We said the mental health has been taken.
Mental health is a third, back as well.
Yeah, if we have like that table to say, hey, look, put it in front of the client.
Yeah.
Like
Well, all our claims stats are interactive. So I'll send Caroline some. We've got so much information to help you. Like seriously, it's probably too much at times. But if you know what we've got, you can really use it to your advantage with your client conversations. You can use some of this cost of care, someone like you, tool in conjunction with claim stats.
Yeah.
Our claim stats are all in. When I say interactive, they'll move. You can press male, female. You can look at the different products. We bring out our claim stats for each prior year. So like last year's claim stats will typically come out maybe mid this year, each year. And, we're looking at obviously because we've got two product sets, one Puff and Zurich, we bring them both out at the same time. All right, sorry, we're nearly running out of time. I guess again, you can just have a look at it, what are these again, very stat heavy this session for a Friday afternoon for you, but 1 in 2 will be diagnosed with cancer in their lifetime. I mean, these stats are real, right? 155 suffer a coronary event every day, and someone every 19 minutes has a stroke. So again, these are the big 3 things that people claim on with trauma cover as well. So you look at that and go, well, that's why.
I always thought it was 1 in 3 cancer. 1 in 2.
These are some of the sorry, it's gone. these cancers and so forth, conditions are all on the rise as well. And many of these increasing obviously with population growth as well. And I guess these numbers too, from our first white paper in 2018, our first volume of cost of care, these have increased significantly in terms of stats and occurrence as well. Now, I guess the next slide, probably again, we wouldn't be surprised, but a lot of this is based on lifestyle. And, we're seeing a lot of these things in society are based on, are we not exercising enough? Are people drinking too much? You see down the bottom, some of the cancers that are more prevalent because of these driving lifestyle factors as well. And, really, I guess society has got sort of worse around these implications. I'm busy, I'm getting processed foods, I'm too busy, I can't exercise. Oh, I can't park my car, I don't have time to walk a block. Do you know what I mean? So it's about physical activity, it's about the lifestyle, diet, etc. That's driving a lot of these numbers up. Again, nutrition, Alrighty, so we're at the very end now, and I'm a little bit over. Sorry.
No, that's okay. I think it's such an interesting topic, and
and again, I've gone through this relatively fast. If I just go back, this will just sort of play you. Just going to go back, and then hopefully it'll. Okay, so this is what it kind of looks like on the screen on our Zone platform, and you've got access. You have access. So, as I said, there's more covered events. There's this report you can see that's behind the scenes. That all comes up with the numbers popping out at you, and you can see there's prostate cancer again. That will show you the numbers, a likelihood. I did my eyes tested. I can't read that far ahead, but you can see all that can come up interactively for you to go through. I've seen advisors go through this in a meeting with the clients. Quite powerful. However you want to go about that. And you can actually click back and forth through the sections as well. So like if you want to click and look at the stats on infants, and then you wanted to go to look at something else, you can have a look at it. The other things I did miss, but when you're in the research too, there was a big request around putting in details around motor neurons disease, Parkinson's, and I think a bit more on MS as well. So they're quite, topical as well, particularly motor neurons as well. So the Someone Like You tool is awesome. Again, that looks a bit not as great, not as cool as what it is because it's so small, but sort of comes up like a one pager. And this is developed a lot. We didn't have this. We had something I think in Excel in 2018 for this, but this is super cool how to use it with the client. But yeah, you can see I can't see the age of the client.
25 to 20
there. But it shows you how old the client is. And then it sort of goes through and says, in 2023 there was 539 cancers diagnosed in this age group. Tells you the stats around melanoma and what they are, and some of the costs associated. So that's really powerful information, I would think, that you can choose to use however you like. And as I said, now this is all electronic online. The idea is that we keep updating this information as well.
I think that part's not accessible through the.
It's not. You need me to give you a link.
Can you do that?
Yeah.
Yeah, we'll circulate it.
Yeah. So I'll package up some info for you guys. Again, sounds like I'm going to be sending you through heaps of stuff, but I'm more than welcome to come and have a one-on-one meeting if you feel like you want to upskill a bit on insurance, whatever that might look like. Looking at your insurance philosophy, your process. Pre-assessments. We've got help we can do for any of this. So
I think it's really important and relevant, Kirralie. One of the things we've seen is AFCA challenging the levels of cover that advisors have recommended. And as a consequence, they've been making decisions to hold the advisors accountable for over-insuring.
Yeah.
And subsequently clients receiving payouts for, compensation and refunding of insurance premiums paid and things like that. Now, there's no logical rhyme or reason that AFCA have to quote to demonstrate why they've come up with a different number. But they are coming up with very different numbers. And there are significant burdens being placed upon advisors to have to find the money to reimburse the clients. So I think it would be really proactive of the advisors to take you up on your generous offer because there is some methodology behind these calculations.
Totally.
Actuarially supported. And I think it comes back to file notes and everything else that we've been talking about for years to demonstrate, this is how we arrived at this. One advisor even quoted
AFRA statistics.
AFRA statistics.
And AFCA said, no, the client said they'd have half of that, so.
Yeah, I was at another dealer group PDD last year, and I heard this same thing about that with AFCA, which is really, interesting.
So is the client going to AFCA complaining that they paid too much insurance premium?
No, they went about something completely different. And AFCA have looked at everything and suddenly the client is then coached on, but hang on, I think I'm overinsured as well.
It's a very big line for the claim.
It's ridiculous.
Yeah.
So I guess the question is, do you speak with AFCA when you do these sorts of things as well, or they're completely out of the
I personally, I mean, Adam Crabtree does all the research and whatever. I mean, we've obviously, talking to, Kelly and a few other industry bodies, but I don't think it'd be, I don't know, actually. I'd need to check.
Yeah.
But it's,
It's horrendous.
Very, very interesting. So we'll wrap up there, guys. So I've gone well over, and as I said, we could talk about this all day, and I have gone relatively fast over a few things because, there's opportunity to talk about all different products through this, some of the benefits that come through, but it's really about awareness. And I would encourage, I'll send this through, I would really encourage you all to jump into our Zone platform and have a look at the actual white paper and the research. This has just touched on some of the stats. I will send through the link to be able to look at the Someone Like You tool as well, because that's not on the website. So I'll send that through.
Great. Yeah. Thank you. Yeah.
And then, please, I'll put my details on the email as well. I'm, as I said, really passionate about, people having insurance cover. I see the importance. I think that you've got a really financial planner, as much as you get put through I don't know what we say, put under fire, is such a rewarding thing that you can do, is to help protect someone in the time of need, of uncertainty. And, to be able to, say I've helped this particular client in this bad situation is, quite fulfilling, I would think. Not many industries that I know of, unless you're a brain surgeon or something, actually can make such an impact in someone's life. We are just the supplier in the background. So, happy to give you tips and points. I can't give advice, of course, but talk to you about what we've got on offer or who can help with what.
That'd be great.
So, thank you for having Ray and I.
Thank you.
Well, if anyone wants to chat, more than happy to.
So we will have a quick turnaround time. For those online, we'll jump back in. I'll give you an extra 5 minutes because we've got Kate who will talk forever. I'm just not sure where he is. I haven't seen him, but if we can come back at 20 past, go grab yourselves a drink, have a refresh, and we'll be back shortly.
Thank you. Now, if I don't see anyone after you go, I'll see you guys around because I've got another training session. That's my ideal setup, but anyway. Yeah. Thanks, guys. Have a great day.